You are now listening on One Radio, the talk show podcast station, bringing you the unfiltered news and information. This is Let's Talk News Report. Welcome, this is your Let's Talk News Report, and today we are discussing those citizens that are at risk. Their lives right now amid the deadly outbreak is a catch-22. And this is one of the headlines for today. Putting us out on the streets. Seniors face eviction during outbreak. Like I've stated on some of the other shows, that COVID-19 is wreaking havoc across the country. In most sectors, nothing is getting left untouched, from tourism on down. Now, speaking of tourism, with people restricting themselves to their homes and avoiding travel in response to the novel coronavirus outbreak, tourism has taken a decline, and some of the world's most popular destinations now have just a few tourists visiting. The outbreak could cost the global tourism industry more than $80 billion in lost revenue. Now, this was said by the EIU, which is the Economist Intelligence Unit. Now, at 82, Carly P. Angel falls in the category for those at risk of serious illness if exposed to COVID-19. In 2 weeks, she could also end up in the same category as the tens of thousands in California who are at risk and homeless. Now, public health officials are issuing warnings for those in her age range to stay home and self-isolate. But Angel and the 11 other seniors remaining at the Brookdale San Pablo Assisted Living Facility still face eviction at the end of the month. Now, we know that's got to be really hard, and I know that is a lot of weight. Now, we are scared, Angel said. We realize we are a very vulnerable population. We're the ones that COVID-19 is hitting the hardest, and here we are being forced out onto the streets with no place to go. When a global pandemic hits a state already gripped by a housing affordability crisis, the impact is both devastating and far-reaching. Those on the margins bear the brunt the hardest, forced to venture out to fight for their housing when public health warnings are discouraging people from social contact. We're caught between anxiety and terror, Angel said. Some of us don't have places to go. We've been looking and we can't afford them, and the places we can afford are so awful we and our children would not want us to go there. In a state with sky-high rents, more than are willing to admit teeter on the edge of housing insecurity. Self-quarantine without the option to work from home or getting sick without paid sick leave could mean not being able to pay the bills. Fewer work shifts because no one is going out to eat, or a canceled gig because the governor recommended postponing large gatherings could mean not being able to make rent or pay bills. So many of us are just 1 or 2 paychecks away from not being able to afford one of our basic needs, which is housing, said Lupe Arreola, the executive director of Tenants Together. In a state with 17 million renters, more than 55% are cost burden, meaning they spend more than 30% of their income on rent. Arreola said she's concerned that many more will end up homeless in California because of COVID-19 and before the outbreak is under control. Being evicted is horrible, but being evicted during a global health crisis and during an affordability crisis is the making of a societal disaster that will further complicate being able to have positive public health outcomes, she said. Which I can understand that, and we all can understand that. It's sad, it's reality, and it's cold hard truth. Now, the concern over the intersection of the coronavirus crisis and the housing crisis is enough that Sam Liccardo, the San Jose mayor, issued an eviction memorandum for people whose wages have been affected by COVID-19 related closures and cancellations. London Breed, the San Francisco mayor, issued a memorandum on Friday, and Oakland is working on a similar measure as well. The impact of this is far and is definitely reaching far, said the San Francisco lawmaker Dean Preston, who introduced the legislation there. There's lost income for a lot of folks. There are direct health impacts. There's cancellation of events. There are folks who are small business owners who are struggling to stay afloat. Everyone is trying to make sure the impact of this is mitigated. Now, though Marecka Reagan considers herself lucky so far in terms of COVID-19 related cancellations, the panic and uncertainty is palpable on the pet care worker networks and message boards that she frequents. Dog walkers are posting about their walks getting canceled because their clients are working from home now. Pet sitters are losing jobs because their clients will no longer travel. Reagan, the owner of City Heights Dog Walking and Pet Sitting, has had 2 cancellations and a 3rd job fall through for this reason. She thinks herself lucky, but when she tallies up her losses, she realizes she misses out on half a month's rent. Her $2,250 a month housing cost is always a concern for her, but she is optimistic when it comes to the COVID-19 crisis. If she loses more vacationers, she'll make up the work elsewhere. Now, she goes on to say, I'll have to take on more walking clients, maybe 2 or 3 more, which will be murder on my ankles, she said. But what if she gets sick? She states, I don't get sick. My plan is to never get sick. That's my plan. It sounds crazy, but that's my plan. Okay, sounds a little crazy to me. I don't know about y'all, but y'all tell me what y'all think about that. Does she sound a little crazy on that? I know it's being optimistic, but there's a fine line between that. Now, local lawmakers and tenant advocates hope that measures like an eviction memorandum can help ease the minds of workers like Reagan. No one should have to choose between their housing and their health, Ariella said. But besides being the ethical choice, prohibiting evictions is strategic in curbing the spread of the virus, Preston stated. One of the primary ways to prevent the spread of COVID-19 is for folks to stay in their homes, and if folks don't have a home to go to, that's impossible, he said, which makes sense. Now, that's why Angel and the seniors at Brookdale San Pablo are petitioning California's governor, Gavin Newsom, to issue a memorandum on all evictions, COVID-19 related or otherwise, until the crisis passes, which would make a whole lot of sense, and it's just the right thing to do. Nobody really should be getting put out right now. That's just not fair to anyone. The seniors at Brookdale San Pablo were alerted at the end of November that Brookdale, a national senior living company, was not renewing its lease. They thought that maybe another company that specialized in assisted living would take over. But in January, they received eviction notices from the building's owner around the time COVID-19 began to spread in China. There were 83 of them originally, and some left, forced to move further away from their doctors and their families. Now 12 remain, with the cloud of COVID-19 hanging overhead. The virus makes it much more difficult for us, Angel said. Everyone has been talking about the fact that even to go to look for a new place, if we got on paratransit and come back, it's all risky, she said, and other seniors are determined to stay until the end. They hope that the governor or the building's owner will let them stay, at least until they're out of danger of exposure. There is no place like this nearby, at this price, or at this quality, Angel said. They're putting us out on the streets. Now, For a lot of people, that may not hit home for them, but there are lots of people that are living in assisted living facilities. And without that, they don't have anywhere to go. Which means someone should do something about that. Hopefully the building owner will change his mind. Hopefully, guys, if you're listening, if you speak about this, maybe these people can get some help. If you write a letter to the building owner, whatever the case may be, I'm going to research this myself, and I'm going to see about writing some letters to try to get these seniors some help, because I'd rather them stay there than be forced to get out there to try to look for places and get exposed. And then we lose them. I know a lot of people are going to look at this like, well, okay, this is self-preservation. This is humanity. This is doing the right thing, doing the right things, and taking care of one another. That is unity, even in a crisis, okay? We've got to do something. So hopefully something will be done about that. We're going to be praying about that. All right, now moving on to our next headline. 2 New Jersey men use drones to smuggle drugs, phones into a prison, authorities say. How the hell this happened? Your guess is good as mine on that. But I'm pretty sure crooks will be crooks, and they will find ways to get around get around the laws or anything else, and it's sad. But it reads, the United States Department of Justice has charged 2 New Jersey men with using drones to sneak drugs and other contraband into a federal prison in Burlington County. The 2 men, Nicolo Denicillo, 38, and Adrian Gulcherian, 35, smuggled items including marijuana, steroids, cell phones, SIM cards, and syringes into the prison in Fort Dix, New Jersey. Now, this is according to the U.S. Attorney's Office, District of New Jersey. The prison, known as FCI Fort Dix, is a low-security federal correctional institution that houses more than 3,000 inmates, according to its website. Now, Federal Bureau of Prisons spokeswoman Sue Allison declined to comment because the case is a pending prosecution. Law enforcement officials attempted to arrest Denicillo and another unnamed individual near the prison Thursday after prison officials saw a drone flying over one of the prison's housing units. Federal prosecutors said in a statement, the 2 men fled, but only Denicillo was captured, it said. The Fort Dix prison officials also discovered an inmate near the drop site in possession of more than 30 cell phones and 50 SIM cards, among other phone equipment, the statement said. Now, he has been released on $100,000 bond. It was not immediately clear who represented him at his pretrial hearing. Meanwhile, authorities say Gulcherian, who goes by Adrian Ajado and Adrian Ahada, remains at large. Authorities allege Gulcherian used cell phones to coordinate the drops with others, and that prison surveillance footage shows a man fitting his description flying a drone last week. Gulcherian brought multiple drones to a store for repairs shortly after, they said in a statement. Now, in April 2019, authorities said local police pulled over Denicillo and Gulcherian less than 5 miles away from the prison on the same day. Another drone delivery was discovered. In the release, authorities say they obtained evidence of at least 7 drone deliveries since July of 2018 at the prison. A fingerprint from Denicillo and DNA from Gulcherian was also recovered, the statement said. The DOJ charged both men each with 1 count of smuggling contraband into the prison and conspiring to smuggle contraband and defraud the United States. The first count carries a maximum penalty of 1 year in prison and a $100,000 fine, while the conspiracy charge carries a maximum penalty of 5 years in prison plus a maximum fine of $250,000. I don't know about you, but I'm not putting my freedom on the risk for that there. Just not gonna do it. It's not making any sense to me, so I'm not gonna be able to do that one. That's just not. I don't care. Money is not that good, especially with this epidemic going on. They figured it was probably a perfect time, but at the same time, it's really not, because with everyone staying at home, there are less people being active, so it's going to be easier to spot shit like that. I'm just stating the facts here. So that's one I wouldn't do. That was kind of dumb to me, but people have their reasons. I don't know. I guess, but they did it. Now, moving along. Trump administration is relaxing oversight of nursing homes. Yes, Trump administration is relaxing oversight of nursing homes. Now, this story hit about a couple hours ago. The Trump administration has been working to relax regulations governing America's nursing homes, including rules meant to curb deadly infections among elderly residents. The main federal regulator overseeing nursing homes proposed the rule changes last summer, before the coronavirus pandemic highlighted the vulnerability of nursing homes to fast-spreading disease. The push followed a spat of lobbying and campaign contributions by people in the nursing home industry, according to public records and interviews. The coronavirus has killed 13 residents at a nursing home in Washington state. Dozens more residents and employees have fallen ill. Seeking to prevent further contagion, some states, including New York, have banned most non-medical personnel from setting foot inside nursing homes and other long-term care facilities, which nationally have about 2.5 million residents. So it begs the question, who the hell is going to take care of these people? They need care too. Now, last July, the Federal Centers for Medicare and Medicaid Services, or CMS, set in motion a plan to weaken rules imposed by the Obama administration that require every nursing home to employ at least one specialist in preventing infections. The proposed rules, which the agency is completing and has the power to enact, eliminate the requirement to have even a part-time infection specialist on staff instead. The Trump administration will require that anti-infection specialists spend sufficient time at the facility. Critics say the proposed requirement is so vague that it would be essentially meaningless and dangerous. It adds up to less time, less infection control, and that was stated by Anthony Chicotel, a staff lawyer for California Advocates for Nursing Home Reform. He said the proposed change was alarming. Attorneys General in 17 states have called the proposed rules a threat to the mental and physical security of some of the most vulnerable residents of our states, which it is. The White House referred questions to the Medicare and Medicaid agency. Now, in an interview on Saturday, the agency's administrator, Seema Verma, said the proposed rule changes were not about easing up on nursing homes, but about not micromanaging the process. The proposed changes to the infection prevention rules, she said, could actually result in a higher level of staffing. We have to make sure that our regulations are not so burdensome that they hurt the industry, she said. Ms. Verma emphasized that the rules were still in the proposal stage and not yet complete. We have to make sure that we get it right for the sake of patients, she said. Infection prevention specialists are supposed to ensure that employees at nursing homes properly wash their hands and follow other safety protocols. They are widely considered the front line for stopping infection among the leading causes of deaths in nursing homes. Each year, about 380,000 residents are killed by infections, according to the Medicare agency. Failure to prevent them is also the leading cause of citations that state inspectors bring against nursing homes. The coronavirus has laid bare such problems, most likely at the Life Care Center of Kirkland, Washington, where 13 residents have died after being infected with the virus, and more than a third of the facility's roughly 180 employees have contracted the illness. I feel bad for them. Now, the Kirkland facility, which scored a top quality rating of 5 stars from the federal government, has had problems before. In April 2019, the Medicare agency wrote it up for failing to consistently implement an effective infection control program. Now, in its report, the agency described the concerns of a resident's daughter who said that nurses allowed her mother's heel, which had an open wound, to touch the ground, calling the practice unhygienic. The agency found that the facility's shortcomings put residents at risk for harm and transmitting and or acquiring infections. The agency, which levied a $67,000 fine, said the problems were quickly fixed. In recent weeks, nursing home operators nationwide have been cracking down on visitors. Ronald Silva, whose company manages 24 nursing homes in Indiana and Georgia, said his facilities began screening all workers and vendors 3 weeks ago. The Centers for Medicare and Medicaid Services provided new guidance for nursing homes this month, telling inspectors to scrutinize whether employees were following key safety precautions, like regularly washing their hands. Vice President Mike Pence echoed the guidance, emphasizing that all federal inspectors should focus, at least for now, on making sure that facilities are working to prevent and control infections. Now, it goes on to say we're going to put all inspection resources at the state level focused on infectious disease, looking at nursing homes being a focal point of vulnerability and a vulnerable population, Mr. Pence said at a press briefing on March 3rd. Now, Mr. Pence did not mention the Trump administration's proposals to relax the Obama-era rules. The proposed changes are part of a broader effort by the Trump administration to unfetter business from regulations. In the case of nursing homes, relaxed regulations are projected to save the industry about $640 million a year. Now, that's according to the estimates from the Centers for Medicare and Medicaid. Now, in its first year, the Trump administration changed how nursing homes were fined when they violated rules. Previously, they were typically penalized for every day in which a violation persisted, but the agency changed the guidance for inspectors, encouraging them to hand out a single fine rather than a series of daily penalties for most infractions. Now, under the Trump administration, the average fine imposed on a nursing home has dropped more than 30%, from $41,260 to $28,405, according to an analysis of federal data by Kaiser Health News. Now, Ms. Verma said the changes to how nursing homes are fined were meant to increase consistency across the industry. Now, the agency also weakened a rule that would have made it easier for nursing home residents and their families to sue over claims of elder abuse, sexual harassment, and wrongful death. Now, together these changes gut enforced, said Toby Eldman, a senior lawyer at the Center for Medicaid Advocacy, a nonprofit legal assistance group for the elderly. They are a gift to the industry. The administration's moves came after intense lobbying by the nursing home industry, including by the firm run by Brian Ballard, Mr. Trump's friend and a fundraiser. Parlaying his personal connections to Mr. Trump, Mr. Ballard has become one of the most powerful lobbyists in Washington, with the most clients of any registered lobbyist last year. Now, this is according to analysis by the Center for Responsive Politics. His firm has lobbied on behalf of nursing homes in his home state, Florida, for years, according to the public records. He was also a lobbyist for Mr. Trump's Florida golf course, the Doral. Now, after Mr. Trump was elected, Mr. Ballard retained by a leading trade group for the nursing home industry, the American Healthcare Association. His firm, Ballard Partners, has earned $930,000 in lobbying fees from the group since Mr. Trump took office, record shows. Miss Verma, who emphasized that she didn't even know Mr. Ballard, said she didn't like to hear from lobbyists. And it goes on to say, I tell folks I am not going to meet with DC insiders, she said. I want to meet with people on the front lines. Now, a spokeswoman for the nursing home trade group said that loosening the requirement to have an infections specialist on staff would allow facilities to provide greater flexibility to thwart infections. Now, in November, Trump was honored by a group of nursing home operators at a fundraising event at a packed ballroom at the Intercontinental Hotel in Midtown Manhattan. The event drummed up more than $3 million for his re-election campaign through a political actions committee called America First Action. Flanked by 2 American flags on stage, Trump singled out one of the executives, Eliezer Shaner, who donated $750,000, the most of any attendee. And it goes on to say, I want to thank Eli Schneider for doing such an incredible job, Trump said. Mr. Schreiner, who owns 22 nursing homes across the country, received a round of applause. Mr. Schreiner's nursing homes have received subpar ratings from federal regulators. Since 2017, they have been cited more than 40 times for slipshod infection control. In 2018, inspectors at one of Mr. Schneider's nursing homes in Balch Springs, Texas, spotted a staff member who failed to wash or sanitize their hand before cleaning a resident's anal area. That's not cool. Now, during the same inspection, another staff member was written up for allowing a resident's feeding tube to touch the inside of a bathroom trash can. Oh my God, it just gets worse. But do you guys hear how this is linked? Now, 2 years ago, Mr. Snyder was accused of fraud by a federally appointed bankruptcy court trustee in Connecticut. The trustee accused Mr. Schneider and his partner of transferring more than $1 million of assets out of one of their nursing home companies into other entities they controlled. A few months before the nursing home company filed for bankruptcy, Mr. Schneider didn't respond to requests for comments. He and the bankruptcy trustee agreed to a settlement this year. Now, in addition to no longer requiring nursing homes to designate at least one part-time infection preventionist, the Trump administration also has proposed adjusting a requirement that facilities must assess what they may need for patient care, from staffing levels to medical equipment. And under the proposal, facilities would have to do such assessments every 2 years instead of every year. Yeah, they're trying to save money big time. But at whose risk is it? Now, Matthew Goldstein and Robert Gebeloff contribute to this reporting. So I want to give them credit for that. But it's just... it just seems like all these things are about money and more and more less about the health and safety of the residents. I mean, you guys just heard it. So you tell me what you think. Message me, inbox me, call me. Let me know how y'all are feeling about all of this. If you hadn't heard it, what do you think about it now that you know? Let me know. This has been your Let's Talk News Report. Thanks for listening. Thank you for taking the time to listen to the Let's Talk News Report. I wish you the best and don't end up on the news over dumb shit. I've been your host, Tony Williams, and this is On One Radio, the talk show podcast station.